I am curious, Matt, because you worked on the ACA, do you feel like in retrospect, could there have been a public option that also would have offered transformational benefits to the health insurance system?
So obviously there was a lot of conversation about a public option back during the debate over the ACA. Listen, I think the advantage of a public option is that it's a mechanism for reducing what are indeed very high prices we see for care in the private insurance markets. And that's a reflection of the fact that private insurers have to negotiate with healthcare providers. Many markets are very concentrated, and that means that whether it be a health system or a physician practice often have a lot of leverage to insist on very high prices for care. I think a public option, by bringing the sort of approach to determining prices that we use in the Medicare system into private markets, could have been a way to substantially reduce prices on the private side. And obviously, it's not the way Congress ultimately went.
Maybe one more ACA question for you, Avik. So Republicans have effectively abandoned efforts to repeal the ACA. Party can't agree on entitlement reform, COVID backlash. It's not motivating voters the way that Ron DeSantis would want. So what is the path forward for Republicans in healthcare?
Well, the big problem that Republicans have had is that there's a lot of disagreement among the Republican Party and among conservatives who talk about healthcare and those who don't talk about healthcare. So what to do? So back in the repeal and replace debate in the 2010s, there were people like myself who were saying we should embrace the cause of universal coverage and show how the private sector could deliver it. That was one end of the spectrum. There were others who said we just need to repeal the ACA and go home. That was a school of thought. And then there were people in the middle who were like, well, let's do some things on coverage and kind of have a half measure. That's where basically Paul Ryan ended up, I would argue. And that was a mistake, right? People do care about having the economic security that comes with having insurance that works. That's a really important policy goal that Republicans were mistaken in avoiding. And also not failing to understand that you need 60 votes in the Senate to do proper health reform. You can't do it with just a 50 or 51 Republican member Senate. So there were there was just not a lot of thought about that. A lot of people were more afraid of whether they were going to get primaried for not hating Obamacare enough instead of actually having a health reform plan that works for patients. And you could see some of that on the Democratic side in the sense that there's a single payer crowd versus the public option crowd, things like that. But Democrats in the ACA context were united in saying, look, we may have our disagreements about how to achieve universal coverage, but we all agree that universal coverage is a goal, and they were able to kind of compromise on that. Republicans were not mature enough in their healthcare thinking, I would argue, to make similar compromises or agreements among themselves, and that's still true today. There is not a consensus among conservatives or Republicans as to what to do, and obviously I do my part to convince them to see it my way.